The reason we do these health debates is because we know that no one can have all the answers. mHealth is a subset of eHealth relating to the application of mobile technologies to healthcare. If someone wants to do something active in this space and actually put a solution in there, how do they get the money to put it in place? And if they do put it in place, does it actually pay for itself? Is it sustainable?
The public budgets around in Europe and in the Western world are not in the best position, as we know now, and it's not going to be better with the developments we have of the aging of population and fewer young taxpayers. So I think maybe public-private partnerships could be a solution.
The public sector has to be able to embrace the private sector. We know we have private sector companies we're working with who would be very willing to put the investment out there, provided they know there is some prospect of a decent return.
We have to be very careful when we look at health issues and not just become driven by the economy, but also think about the better quality of life.
Of course, legislation has a big part to play in it. And this is very often European legislation or national legislation, and where we feel, okay, we need to stimulate innovation. We need to try to provide new ways of actually building up the framework.
So let's imagine that you're allergic to a particular tree pollen, and you go on the website in the morning and you see that there seems to be a real hot spot at your usual metro spot. Everybody with the same allergen as you has had to use their inhaler as they got off their metro that morning. You know now, you're prepared, but it doesn't stop there, because that data can also be used by public health officials. It can be used to build information about what we can do to support asthma sufferers better.
We need to work on a more efficient health system and more efficient public sector delivery, or we will see some brutal cuts, in my opinion, simply out of economic necessity.
When you're using those devices, you can really empower the patient, and once you can empower the patient to take better care of him or herself, the impact on the health service, the impact on the efficiency of the health service should be very significant. Patients are not going to accept, no, I won't let you use that mHealth device application anymore. So I think there is leadership, but I think it's coming up from the bottom, and it's not the top-down leadership that we may be looking for.
We think everyone needs to come together in terms of the change of mindset. I mean, this is not a challenge that one party owns over any other, so it would be unfair to task all politicians or all government to create the environment or to change the mindset, but they can certainly show a leadership in that respect, say it's okay to do it this way.
The policy lack is obviously hindering or not helping us in developing it.
What we really need to do is grasp the nettle and have eHealth or mHealth legislation that deals with the difficult issues of things like liability for delivering healthcare services remotely or privacy of health-related information.
The potential, I would look at it from an economic perspective, but also, let's say, from a quality of life perspective, and I think in both cases it's good, but it does mean that you will have to get away from just looking at when you introduce it as a cost here and now. You need to see it as an investment in a better life, but also probably in savings on the public budgets on the longer term.
It will happen because patients and patient advocacy groups will demand it. It will happen because medical suppliers, healthcare companies who are already in the business of supplying products and services to this space will diversify, and so they will say actually providing eHealth and mHealth is part of our portfolio now. It will happen because suppliers like us produce the enabling technologies, and because the doctors and nurses themselves will say, well, we just expect this to happen.
By using mHealth devices, we can really expand that local pool of stakeholders and get them to engage in healthcare, and I think that's really where the future is.